Hello, my name is Rebecca Harper. This is my presentation on my innovation project video proposal on a mobile application to aid novice nurse practitioners. The content this PowerPoint will address is the problem of novice nurse practitioners entering practice and their need for ready access to knowledge. I will discuss what is known about this problem. I will present information on the application Medscape and its innovative features, and present interviews with my coworkers about the application, common concerns about the use of smartphones in the workplace, along with my references. New nurse practitioners have to meet expectations of employers and patients. Employers expect the new nurse practitioner to quickly get up to speed, to see a certain number of patients, and to provide competent care. Patients expect to get quality care. They do not want to feel that they have a new person that doesn't know anything, such as a Doogie Howser. The nurse practitioner is expected to provide timely care, and a new nurse practitioner wants to have a ready knowledge base and feel competent and confident. What we know about the problem is that textbooks rapidly outdate, references are not always accurate. Books can be costly. You can buy a pocket reference book to carry around in your lab coat, but you have to replace that yearly to really be up to date. There is a large amount of data that you would have to flip through in a common textbook to find the answers you might be looking for. Guidelines can assist nurse practitioners in meeting treatment goals, and you would have to do a lot of research on the net to find specific guidelines for specific problems. Medication doses vary by different types of patients, and it is expected that a new nurse practitioner will provide treatment equal to that of an experienced provider. The application I am presenting is Medscape. It is a product of WebMD. The application is free to download and use, and it can be used on all smartphones. It can store data for use in areas without internet service. It updates itself regularly with new information. I am a new nurse practitioner, and I use this product, and I'm lost if I don't have it. I use it to look up my medications and to look up common treatment regimes. The innovative features of Medscape are its reference section. You can look up diseases and medications. It assists with accurate medication choices and accurate dosing, and provides new journal articles and data about ongoing studies and educational opportunities, some of which have CMEs. The disease and medication reference allows you to search by a disease process. It gives you information on typical presentation of the disease and suggested workup to do to make sure it is that disease. It can give you recommended treatment programs, such as medications or procedures. The medication link can then link to the medication dosing section. The procedures give you directions, diagrams, and pictures of how to do common procedures such as suturing or how to do an incision and drainage of an abscess. The medication lookup provides for accurate dosing for adults, pediatrics, and whether or not the medication is safe for use in pregnant patients or those that are breastfeeding. Gives you information on renal dosing of medications, contraindications, common side effects, and suggested monitoring. A calculator allows you to input a chosen dose, such as an antibiotic that you want to do a high dose or a low dose of, depending on the problem, and the child's weight so that you can get an accurate dose for that particular child. There is an interaction checker to assure the provider that the medicine you are choosing will not interact with the medications the patient is already on. Medscape provides users with up-to-date articles and information on ongoing studies. These to the right are examples of the available articles. One can also select to review specialties such as oncology or cardiology or obstetrics. You can search for specific topics or previously read articles in a search database. Articles come into the inbox on weekdays. Medscape has ongoing education. One section is called Critical Images, and there is an example of this. It shows presentations of diseases that you might see in practice, such as skin cancer or rashes, and tips on how to identify them. There is another section that presents case scenarios with X-ray pictures or EKGs that you interpret and you select treatment options, and then it tells you what the outcome was and what the specific treatment should be. Some presentations are teaching presentations and give continuing education. Medscape has a CEU tracker that will keep up with earned CEs and allow for printing to give to your employer or to send for professional licensing boards. I interviewed several persons from different professions at my job to ask their opinion on this application and applications in general. India Kerman is a pharmacist. She likes this application to assist new nurse practitioners provide proper and accurate dosing of medications. Although she would not personally use this application, she said that she would recommend it to other new nurse practitioners. She does like to use apps such as one for relaxation, as she likes alternative therapies. Barbara Bartell is a RN case manager. She likes the dosing aspect of the application, but she is not comfortable with technology and would likely not use it. Annette Taylor, the practice manager, voiced concerns about using smartphones in exam rooms. She does like the app's potential to improve new nurse practitioner skills and their competence. Some of the concerns about such an application is whether the smartphone is being used appropriately. There have been instances of breach of confidentiality and HIPAA violations, such as taking pictures of patients and posting them on Facebook. And patients may perceive that the nurse practitioner is texting or playing a game rather than paying attention to them. There is also the potential for distraction, such as receiving a text or a phone call while you are examining a patient. It is important to clarify what you are using your smartphone for. In conclusion, the application Medscape can assist new nurse practitioners to practice with confidence and use up-to-date treatment modalities. It can improve patient cycle times and thus improve productivity. It can bring proven guidelines more rapidly into practice, and we have seen that that tends to be a problem, that guidelines are often not used. It provides opportunities for continuing education and keeps nurse practitioners up to date through daily articles and studies. Thank you for your attention. Does anyone have any questions? These are my references.